Hello and welcome to this special program. I am Mohammed Youssef. The Kingdom of Bahrain has made yet another achievement in its fight against COVID-19 by being the first Gulf country to host a World Health Organization office, which will serve as the next step in the city's developments as a global center of health research, practice, and innovation. In this special program today, we highlight the visit of Director General of the WHO, Dr. Tedros Ghebreyesus, to the Kingdom of Bahrain. This visit reflects the Kingdom of Bahrain's great advancement in the healthcare field, thanks to the wise leadership support to the sector. His Majesty King Hamad bin Isa Al Khalifa commended the opening of Manama's WHO's office, which embodies decades-long relations and joint cooperation. He also commended announcing Manama as the first capital health city in the East Mediterranean region in recognition of the quality primary healthcare services and initiatives to promote health awareness and combat chronic and communicable diseases. His Majesty the King underlined Bahrain's strides in combating the pandemic and mitigating its fallout, highlighting the national vaccination campaign and the directives to administer jabs to all citizens and residents free of charge. His Majesty the King commended the unwavering efforts of Team Bahrain, led by His Royal Highness the Crown Prince and Prime Minister, Prince Salman bin Hamad Al Khalifa, and all medical and nursing frontliners and other supporting sides, hailing the cooperation of all social segments. But meanwhile, Dr. Ghebreyesus praised Bahrain's pioneering edge in combating the pandemic in compliance with the WHO recommendations. He hailed His Majesty the King's wise leadership, adding that the organization looks forward to stepping up relations with the Kingdom of Bahrain to bolster health, contribute to the safety of the world, and serve the needy. It is important to note that the WHO office will serve to enhance and strengthen the national capacity for proficient health service delivery and help in advancing the global health agenda as stated in the UN SDGs. It will also further enhance Bahrain's position as a regional health policy leader. The opening of the WHO office serves as the next step in Bahrain's development as a global center of health research, practice, and innovation.
Actually, I think the visit of the His Excellency Mr. Tedros is actually to visit Bahrain and see what's happening actually in Bahrain, because I think the information he got that we are doing well because we are actually always ready. Before the events actually happen, we are actually had put the worst thing. Actually, we prepare for the worst thing, and that's why I think things had not been out of control. And I think our in the last few weeks, I think from May on, the number had risen, very quickly and very, but we control it very quickly, and because of the close-up and for the vaccination rate had actually was the success story for Bahrain, that within a few weeks actually had gone from almost 28,000 patients actually in Bahrain to now it's less than 1,000.
As you know, Bahrain is advocating and continually preaching for peace for everybody in the region. We want to create a safe, secure, prosperous environment, not only for Bahrain, but for the peoples of the region. This office will be the nucleus for the health diplomacy, for spreading the knowledge of health, especially the lessons learned throughout the campaign that we had in fighting and mitigating the pandemic. With that, we will be able, hopefully, with the cooperation with the WHO, to achieve health for everybody and health by all.
Well, actually, we are very glad today that we are having Dr. Tedros, the Director General of WHO. And this recognition for Kingdom of Bahrain is something is an added value for us. I think within this pandemic for COVID-19, it gives us an opportunity that we have to talk about our achievement and what was done here in Kingdom of Bahrain. We know that we achieved, let us say, maybe the first on the world for testing, and we are one of the three top of vaccination in the Kingdom of Bahrain. Not only that we have a very successful approach and dealing with high number of positive cases in the kingdom, and we managed to reduce it with the whole team, with the whole population of Bahrain, with the good actually awareness about them, that we reduce it to about less than 100, and this is a great achievement. This give us more, let us say, trusting from the population and from ourselves that we are in the right track.
And now let's watch these comments about Bahrain's efforts to address the COVID-19 pandemic by the Director General of the WHO, Dr. Tedros Ghebreyesus, during a press conference held here in Manama jointly with the National Medical Task Force for combating the coronavirus, with the participation of the WHO country representative.
It's a great honor for me to be in Bahrain to open WHO's new office, our 152nd office around the world. The WHO country office will deliver strategic, technical, policy and service delivery support to the government to advance health and well-being nationally, regionally, and globally. The opening of this country office reflects WHO's commitment to serve all countries at all income levels, providing support tailored to the needs of the country and its place in the global health architecture. During my visit, I have been very impressed by everything Bahrain has done to prepare for and respond to COVID-19. Yesterday, I had the opportunity to visit several facilities. First, a drive-through facility where I was very impressed. The second, that idea, by the way, is taken from the private sector process, and that kind of innovative idea and also learning from the private sector is very important. And the second is the exhibition center, which has been converted into a medical center, the red zone on one side, and the vaccination area and research area, the green zone, on the other. And I was very much impressed by the type and number of research which is being done to understand COVID. And I hope these studies contribute to the global knowledge. And I would like to commend the government for that. And third, we visited a parking lot, former parking lot, which has been converted into an ICU unit with 130 beds, which is very important for providing care not only for patients with COVID-19, but all patients. And I learned that this 130 beds ICU unit was completed in 7 days. And you can imagine how Bahrain was doing things with a sense of urgency. And a surge like that in 7 days is very impressive. And fourth, we visited a rehabilitation and triage center, which brings everything together in an integrated end-to-end service, which is very important for providing care that is patient-centered. And then finally, we visited a mobile service using the blue buses that have converted from public transport to provide health services in communities. And if you take the two together, that's the drive-through and the mobile service. That's why Bahrain has been testing 20,000 people a day, which is, compared to many countries, really big intervention. It's because of these innovative ideas. And as you know, without testing, you wouldn't know where the virus is, and your intervention cannot be as effective as possible. So the intervention starting from testing, and that follows is tracing, and the treatment can be influenced actually by the number of cases we test, but at the number of people we test, but at the same time the follow-up of those cases or their contacts to fight the pandemic wherever, or to fight the virus wherever it is present. And then I was so impressed actually by the level of innovation, and also I said, as I said, by the focus on providing integrated patient-centered care. I was also very pleased to see the number of women involved in leadership in each of these facilities, and I have also encouraged the government to include women in the COVID-19 task force. It's pleasing to see that COVID-19 cases and deaths are now near the lowest level since the pandemic started, but I urge you not to let down your guard. That's what I expect, of course. The Delta variant is now wreaking havoc around the world, and many countries are now seeing increase in cases and deaths despite high vaccination rates. Complacency is as dangerous as the virus itself. I also have 3 requests for Bahrain. First, we urge Bahrain to continue striving to make progress toward this universal health coverage, especially by building strong primary health care. You're doing it. Pushing the same thing more aggressively will be important. Bahrain has demonstrated its commitment to universal health coverage by passing a health insurance law last year. But there are always more services to cover and financial gaps to close. Second, we also urge Bahrain to continue a comprehensive approach to protect its people from COVID-19. The pandemic is a long way from over, and every country must continue with a tailored and consistent approach of public health measures and vaccination. We also seek the Kingdom of Bahrain's support for controlling the pandemic regionally and globally. To do that, WHO's target is to support every country to vaccinate at least 70% by the middle of 2022. If we can do that, we can control the pandemic. To reach those goals, we need 11 billion doses, and we need your support and voice to make this a reality. And third, we seek Bahrain's commitment for strengthening health security nationally, and based in its very strong experience now, to share its experience regionally and globally. At the World Health Assembly in May, member states agreed to hold a special session of the Assembly in November of this year to consider developing an international treaty on pandemic preparedness and response. One of the major gaps exposed during this pandemic has been the lack of international solidarity and sharing. The sharing of pathogen, sharing of data, epidemiological information, resources, and technology. A treaty could address these fundamental weaknesses by providing a solid foundation for enhanced cooperation, and we seek Bahrain's support for this important initiative. Once again, I assure you of WHO support for the Kingdom of Bahrain and our continuing commitment to work with you to promote health, keep the world safe, and serve the vulnerable.
Welcome back. The WHO office in Bahrain will further develop an already close working relationship between the Bahraini government and the WHO. The WHO's presence in the kingdom will facilitate the collaboration between authorities to ensure that the experience in Bahrain can be shared with others more easily, especially on actions taken to combat the COVID-19 pandemic most effectively. And to speak more about the office and how it will further boost Bahrain's medical development journey, we are pleased to be joined here in the studio by WHO representative and head of office in the Kingdom of Bahrain, Dr. Tasneem Atata. Hello and welcome, Dr. Tasneem.
Hello, and it's really a pleasure to be with you here today.
Doctor, congratulations on being appointed the first head of the WHO office here in Bahrain. Can you tell us more about the role of the office?
The WHO office in Bahrain is the 152nd office globally. And this country office is providing strategic, policy and technical support to government, Ministry of Health and key stakeholders to advance health and well-being. The opening of this office is coming to crown a long-standing relationship between Bahrain and the World Health Organization, as we have been working together for decades. And this huge milestone of having the country office in Bahrain would enhance and would strengthen this relationship to advance health and well-being at a country, regional and global level.
The Kingdom of Bahrain has exerted tremendous efforts in the fight against COVID-19. Tell us your view on Bahrain's experience, especially with the recommendations of the WHO.
The WHO Director General, Dr. Tedros, have been emphasizing since the early days of the pandemic that the only way to beat this pandemic is by the commitment of leadership at a higher level and by adopting whole of government and whole of society approach. In Bahrain, the response to COVID led by His Royal Highness Crown Prince and the Prime Minister is a prime example at a country level, regional level and global level by mobilizing all resources, leading strategic intervention and adopting a holistic approach that have been extended to involve all key stakeholders. I had the opportunity to visit number of health facilities, testing facilities, and vaccination facilities in Manama, and I witnessed the commitment of the team working as one. So congratulations to Team Bahrain for the high level of commitment and for providing high quality services as one. And this is basically articulating and presenting at all levels the commitment of the team.
How does opening the WHO office here in Bahrain reflects the cooperation between UN organizations and the Kingdom?
WHO is the lead health agency in the United Nations. In the recent weeks, the United Nations in Bahrain signed the framework to advance sustainable development goals with the Ministry of Foreign Affairs. And this framework is articulating key interventions that the UN system in Bahrain will be implementing to advance the implementation of the Sustainable Development Goals. And with this, WHO included key health activities that have been based on the priorities of Bahrain. WHO is also working with the United Nations organizations to advance health and well-being and also to integrate health in all policies.
Doctor, how do you evaluate Bahrain's wise management of COVID-19 health situation led by His Royal Highness, the Crown Prince and Prime Minister, Prince Salman bin Hamad Al Khalifa?
Even before the first case have been announced in Bahrain have been taking strategic measures to advance its preparedness. And this was a huge statement that is reflecting the wise management and leadership. Bahrain implemented number of strategic activities in line with the World Health Organization recommendations, not only limited to surveillance and monitoring of cases, but also to tracing of cases and the vaccination, which have been showing great achievements of Bahrain, where Bahrain is one of now the leading countries at a regional and also at a global level, where about 70% of the population have been vaccinated with 2 doses, is also another statement that is showing the country's strong commitment to respond to COVID and also to advance health security.
The Kingdom of Bahrain has put plans and strategies to improve its health sector, from primary care to health insurance. How do you value that?
Bahrain have number of achievements that shows its innovation at a country and regional level. For example, the nursing program is one of the best nursing programs in the region. Moreover, during the pandemic, Bahrain ensured the continuity of the provision of all essential healthcare services to its population. In the recent weeks, Manama was awarded as a healthy city, and it was one of the first capitals in the region to be awarded as a healthy city. All this is basically reflecting on the strong leadership and commitment putting health as a priority.
And Doctor, in conclusion, what are your aspirations for the WHO office here in the Kingdom, and what do you aim to achieve?
WHO Country Office in Bahrain will implement the global and regional strategy for the World Health Organization, aiming for health for all by all. Moreover, we will establish a flagship destination to provide strategic policy advice to advance health and well-being. We will be working with the Kingdom of Bahrain to select number of innovative interventions where Bahrain, as an incubator of success, will be exporting this innovation to other countries in the region and also globally. Moreover, we will be working with UN agencies, other ministries, and academic institutions on number of activities that would address the priority of Bahrain and support the actions of the country to advance the realization of universal health coverage. For me, as the first representative of the World Health Organization in Bahrain, I'm proud and honored to be a member in this community. And I want to really say thank you for the team of the Ministry of Health, led by Her Excellency Dr. Faiqa, for welcoming me to be a member with their team. And I'm so thankful for this opportunity to serve Bahrain and to serve the World Health Organization.
Thank you so much, Dr. Tasneem, for joining us. It was an honor.
It's my honor too. Thank you.
This marks yet another outstanding achievement for Bahrain in further boosting its international status and enhancing its healthcare developments. The visit of Director General of the World Health Organization included touring the kingdom's COVID-19 vaccination and testing facilities, where he was briefed on measures taken by the kingdom to protect the health of citizens and residents. The tour gave the Director General a first-hand opportunity to inspect Bahrain's vaccination infrastructure, which has vaccinated over 70% of the population, an accomplishment that was described as a momentous achievement. We take pride in such national achievements, and we are always eager to accomplish more for the best interests of our beloved kingdom. This brings us to the end of this special coverage. Thank you for watching and have a great evening. Goodbye.